What's going on, beautiful people? What's up, black man? Hope you're doing well, protecting your mental, finding time for an emotional release valve, and continuing to strive to become beneficial. So, over the past 5 or 6 years, maybe a little bit longer, there has been a lot of effort and interest in trying to help men in general, but specifically black men, with dealing with mental health. Uh, Things like depression, like anxiety, like bipolar, a lot of different um, conditions, I'll say. So in today's study hall, I'm going to be reviewing, really just watching and reviewing and taking notes and learning myself from a video entitled Depression in Black Men from Our Health Media Network. And so I'm just going to watch this, share it with you all, and see what we can learn. So again, what's up, Black Man? I'm Jamal Calpin, and welcome to the Beneficial Black Man channel, where we focus on overcoming gray mediocrity to become beneficial for our community by discussing faith, creativity, personal development, and mental and emotional health management. And so a big proponent in what I believe in, what I think is helpful for us as men, as Black men, is we need to think better. And I think our mental health has not been in a good place for a very long time. So we need to keep learning how to improve it. We need to keep learning about ourselves and learning about the state that we're in as Black men so that we can become better for ourselves and then better for our community so that we can live for glory and for good. So let's get into this video. And it's entitled Depression in Black Men. I'm going to play it at 1.25 just so we can get through it a little quickly. All right, here we go. And again, I haven't seen this video yet, so we'll see how it goes.
Coming up next on Primary Care, depression in Black men. Many suffer in silence.
We are alone at the very time that we really need to be reaching out to others.
This music going.
Hello, and welcome to Primary Care. I'm your host, Dr. Lonnie Joe. Depression is one of the most common mental disorders in the United States and affects an estimated 17 million people each year. Black men are just as likely as anyone to have depression, but less likely to get help for it. Left untreated, depression can lead to chronic conditions like diabetes, high blood pressure, sexual dysfunction, substance abuse, and even death.
Wow, I didn't know about what did you say? High blood pressure? Diabetes. I didn't know I didn't know diabetes could be tied to depression. Some of the other stuff I was aware of, but diabetes, wow. That's intense.
According to the Centers for Disease Control, suicide is the third leading cause of death for African American males aged 15 through 24. Black men can no longer live in silence and in the shadows of this treatable condition. Here to shed more light on this topic is Dr. Harold Woody Neighbors. Dr. Neighbors is a CS Mott endowed professor of public health at the Michigan State University College of Human Medicine. His research focuses on developing community-based programs that improve the health of Black men. Dr. Neighbors, welcome to the program. Thank you for joining us, Woody. Excellent.
Before we get into Dr. Neighbors' discussion and their conversation, let me go back to this. Suicide or self-deletion is the third leading cause of death for Black males 15 to 24. Okay. I need to. So this video is from 6 years ago, right? I'm curious to know what the first two are. So let me see if I can find that real quick. So Centers for Disease Control, causes of death. All right, let's see. Centers for Disease Control. Leading causes of on this page. Huh. So this is from 2018. Oh, they haven't. Wait, hold on. Is there not a newer one? Wow. There is not. 2018 is the most recent one. Okay. Okay, let's focus on if I look at this list. Interesting. So, leading causes of deletion: males, non-Hispanic, Black, United States. And this is from, let me see if I can share my screen so you can see what I'm saying. While I look into, because I'm definitely going to come back to this, but I'm just curious. So let me, okay, I think I did that. Okay. Share screen. This is interesting to me. All right. So center, okay. Health equity and minority health, leading causes of deletion. Okay. I guess we can do age group 2024. Oh, wow. It's number 4. Okay. So overall, Black, non-Hispanic, Black male, all ages get heart disease, cancer, Alzheimer's, stroke, homicide, diabetes, chronic lower respiratory disease, kidney disease, septicemia, hypertension. Oof, okay. But we jump down to 20 to 44. We got, that sucks, yo. From 1, why is this 1? That's crazy. From 1 years old to 44 years old. Number 1 is deletion. Number 2 is unintentional injuries. How are they even recording that or quantifying that? Oh wait, I'm not even sorry, guys. Wasn't sharing the screen. Yeah, so this is from the CDC: leading causes of deletion: males, non-Hispanic, Black. This is 2018. Um, So this is the list from 2018. I would think that they would have a more updated one, but I wonder why it just stops at 2018. Probably because they have to take into consideration like COVID and all this stuff. But anyways, so from 2018, heart disease, cancer, Alzheimer's, stroke, deletions, diabetes, chronic lower respiratory disease, kidney disease, septicemia, hypertension. But there's such a jump between cancer and Alzheimer's disease. Like all the other ones are like close in a certain, like a smaller percentile, but it's such a huge difference between 3 and 2, then really from 2 to 1. But focusing more on 1 to 44. You got number 1. Number 1, deletions. So high. Then unintentional injuries, chronic lower respiratory disease from 1 to 19, and then from 20 to 44, heart disease. And then 4 is self-deletion. Like, oh, yo, this is not good. This is not good. Okay. So in the video, they said that it was number 3 at that time. Oh man. So, wow. Okay. All right. Sorry. Let's get back to the video. Third leading cause, Black males. Okay. Let's just push play.
Life.
Sorry, guys.
Black men seem to suffer disproportionately from the disease. Black men. Why?
Well, it's not clear to me that we suffer disproportionately from the disease of depression. But I have to say that we, more than any other group, are not getting the help that we need.
So the
and not
results of
getting
it
the help
stands
that
out.
we deserve.
Good point. So the
Yeah.
results of being depressed stands out because it's untreated.
Exactly. So I think the question that comes up is, why won't Black men seek help? I mean, it's just that simple. Now, that's a general problem for all men, but I think it's a more pressing problem for Black men. And it's not just for depression, it's for some of the other conditions that you mentioned: diabetes, hypertension. We have a problem in reaching out to get the help that we need.
Yeah, in my office, they're the last ones through the door. And,
Yeah.
in terms of complaints, and then they don't complain as much. I mean,
Right.
they're so stoic with their own
Yeah.
assessment of themselves. I mean, it leads to other problems. But if you have to define depression for our viewing audience, how
I, I'm sorry, I need to stop faster. But I think it's interesting that he would say that, which I believe is true, that a lot of Black men are stoic or not as expressive or communicative when it comes to dealing with our issues, whether it be emotional, whether it be mental, or whether it be physical. That that's not good. That's not good. Like, and I think that's a belief that we've adopted and think that we have to uphold as men, that we need to just not express our needs, not express our pain, not express like the things that we're struggling or suffering with, because that's what a real man is supposed to do. Not talk about anything, not have pain, not have weaknesses, not be hurting. And I would say, even for myself, not being burdensome. Like, if you have any pain, if you have any problems, you don't want to be a burden to anybody else, because men aren't supposed to be burdens. They're supposed to be the burden bearers within our community, within our society. But it's not healthy to neglect yourself, and it's not healthy to not express that you have problems, that you have issues in whatever situation. Just like trying to handle everything by ourselves is not healthy for us. It's not healthy for anybody, but it's not healthy for us, especially when at the core we are actually very communal people, and so we need to talk about those things.
would you define it?
So the way,
Let me go back a little bit.
Complaints, and then they don't complain as much. I mean,
Right.
they're so stoic with their own
Yeah.
assessment of themselves. I mean, it leads to other problems. But if you have to define depression for our viewing audience, how would you define it?
So the way I think about depression is in very personal terms. You can look in the diagnostic manual of the American Psychiatric Association, and you can read through the list of symptoms. I don't really recommend that people do that. I think there's a more basic way that we can understand depression. And the first point I want to make is that depression is not normal sadness. I'm going to say that again. It is not normal sadness. I think a lot of folks are, I think, too loose with that word depression. They say, "Oh, I'm depressed." What they're really saying is, "I'm just kind of having a bad day, a slow day." That is not depression.
There is a difference.
Oh, it's a clinical difference. And so, for example, one way I think we ought to think about this is that you really, truly don't feel like you are your normal self. I think all of us have a sense of, who we are, what we like to do during the day. So, for example, when I get up in the morning, I'm fired up and ready to go. I've had a period in my life where I was going through a very, very low period due to the loss of a child. So I was just devastated from the whole experience. So I didn't feel like getting up in the morning, even though I had a job to go to. I didn't want to. The thing I enjoy most in the morning is a good hot shower. When I was going through this depressive episode, the thought of getting up and turning on the water and stepping into that shower seemed like an insurmountable task. Those are the kinds of things that you can look at to start to figure out, are you really into something where you need to get some professional advice about your mood? Some of the other things a person ought to look at: trouble concentrating. I mean, because of my job, I'm concentrating all the time, but I would have periods where I'm in a conversation with someone like you, and my mind is just off somewhere else. Trouble concentrating, overeating, undereating, sleeping too much, sleeping too little, not enjoying the kinds of things that you typically do. Those are all indicators of perhaps being depressed. But I want to emphasize that for most of us walking around, if you're feeling like you're in significant emotional pain, that is the time for us to get over as men, whatever it is that's holding us back from getting help and getting to a qualified professional person, either a primary care physician, a social worker, or a psychologist who can walk you through the assessment to figure out whether you really are clinically depressed.
I think it was good, and I appreciate his list of different ways that you can try to start identifying if you are depressed, because it looks different for different people. There's no, I don't think there's a set catch-all for what depression looks like in people's lives. You know, he gave the example of not wanting to get out of bed. Sometimes people who are depressed can almost be the opposite. Like they overwork themselves. You know, they are always working, they're always busy to try to hide from the fact that they are feeling terrible. He gave the example like overeating. I wrestle with that sometimes too if I'm, having a depressive episode, like overeating or drinking too much. It can show up in so many different ways. And I think it's important that we try to pay attention to ourselves and really question, are the things that we're doing actually healthy? And are they part of our normal day to day? Which is hard because if you've been depressed for a really long time and you never knew how to identify it or recognize it, your depression can just feel normal. And you're not aware of what anything else is, how it's different. You know, if you've always seen or looked at life black and white, it's very difficult for you to know that there's supposed to be like a more colorful version. And I think for a lot of guys, especially if they've gone through like traumatic experiences in their life at a young age, they've already started adopting and accepting circumstances and situations and trying to like navigate through trauma, that their depression has always just been there. And they don't really know what to look for outside of that. And I think that's hard, but I think in general, I think that's why it's important that we really should get therapy, just like we should get, regular checkups physically. We should get regular checkups mentally with our mental and emotional health so that we, have somebody else give a perspective. Because sometimes, again, if you're always seeing things muted or gray, it takes somebody else asking you questions like, well, do you see these greens? Do you see these reds and blues? And if you're like, what are you talking about? That can give you a different perspective on what you need to change or potentially address in your life. But I appreciate him giving that list of different things that, different ways that you can kind of recognize depression.
So we need to embrace the idea, if nothing else, as men, patients, and particularly Black men. At the opening, we quoted a statistic: suicide in Black men between the ages of 15 and 24 being the third leading cause of death. I don't think people really know that.
No. I think a lot of people walk around thinking suicide is a quote unquote white thing. Now, let's be clear, the suicide rates for white Americans, particularly white men, is higher than it is for Black men. But certain age groups within Black male community, we are, see a spike, and you've picked out the group that is of most concern.
So if we were to look at the conditions that exist in that age group, not just depression and some of the other things, you're probably not dealing with a lot of the long-term disease states necessarily. They're not old enough. They haven't set in just yet. We may see some of the beginnings of it, but they haven't set in yet. But there are other social factors. So other.
Before he gets into it, if this was 6 years ago and he's looking at the CDC of what they were saying from 15 to 24, that means those people, those young men, are 21 to 30 now. And if they're individual, I mean, those are that's the percentage of those who self-deleted or whatever. But if you have this age group that really struggles with this, it seems to be very prominent. enough for it to be the third leading cause of deletion, those individuals are probably still struggling with it 6 years later. Oh man.
There's social environmental factors
Right.
that affect that age group, and they wind up depressed at alarming rates.
Yeah. So in my opinion, all of this goes back to social determinants. And when I say social determinants, I'm primarily interested in education and employment. The way those social determinants affect the Black community, you take another step back, and that is really the legacy of racism and slavery that has, I mean, that's really laid the unfortunate context with which a lot of us are dealing right now. So even though my research focuses more on the people who are experiencing the symptoms, we can't ever forget that the social determinants are really what's driving a lot of this. So the research that I'm doing now, and a lot of it was done in Detroit, the younger guys in our groups, our research groups, are talking about the loss of hope for the future. So hopelessness is one of the big problems. Hopelessness is, by the way, another indicator of depression, can be. But in my opinion, it's the lack of economic opportunity coupled with poor educational preparation that is saying to many of our young men that they're not seeing a positive future for them.
That's crazy, yo. Like, sorry, this is kind of heartbreaking to me. um, but I can understand that. Like, if you don't have hope for anything, like the other day, trying to think who I was spending time with, but I'm trying to think who I was spending time with the other day, but having this conversation about, I think it was some of our friends, but we were having conversations about how dangerous it is now, especially in like the DMV DC area. There are just a lot of young men deleting each other and deleting other people, and people being caught up in these mass deletions. And something that one of our friends was kind of asking about was like, I don't understand how somebody could just take somebody's life and not understand or like respect another person's life. Like, even though you may feel a certain way about yourself, how can you just not honor somebody else's life? Like, you being so careless and taking somebody else's life. And I think a lot of this is tied to what this guy is saying, what this doctor is saying, that if you have such a negative view of yourself, such a negative view of the world around you, and you don't appreciate or see the value in life, in your own life, you can equally look at other people's and not value their lives. Because I mean, even if you don't value your life, if it seems like somebody else values their life more than you, that could lead to envy. That can lead to a lot of like other negative emotions and lead to like anger and wrath, or deeper things of sadness, resentment. And so like this, I think this expresses the importance of why we have to take care of ourselves and why we have to know ourselves better and have a better, healthy understanding of, again, our mental state and our emotional state, and teaching, especially the young people in our community, how special they are, how valuable they are, how important their life is, and the fact that they're actually amazing. Like, if you don't have that sense of self-worth and hope, like, that's really like a soup for disaster. And I can see why that would lead to lots of self-deletion. I can see why that would lead to depression and so many other mental issues, relational issues, and so many things. That's wild.
Suicide could be one result of that. And I might add access to handguns is another problem.
So the infiltration, the increased infiltration of handguns in underserved communities is really startling.
Yes.
Woody, in the African American community, the church plays a big role. The spiritual lives of people has always been a big role, but in the African American community, it's different and it's special. I ask patients all the time, where you go to church, they identify with a church, even if they haven't been in a very long time. They identify with a minister. When it comes to this disease state of depression, where does the role of the church come in, the role of the pastor, and this interaction with Black men? What role does that play, and where does it come in with African American men?
Well, to be honest, I wish we knew more about that question. It does come into play, but I think the point we're trying to make is that we as Black men need to take even more advantage of the kind of things that the church and people that we know that are members of our church can offer us when we're in a high distress situation. So
I think that's interesting that the host asked that question, because I'm curious to know, like, even sure, in his practice, he may talk to people and ask them about their churches and stuff, but from what I see and from what I hear, Black men actually have a really kind of strained relationship when it comes to organized religion, more specifically Christianity. I feel like you can see it in a lot of the churches, or even if you just broadcast stuff online or whatever. Majority of the attendees and those who are involved are women, and I don't know. Like, I think that is definitely something to take into consideration and probably to do more research on. Just maybe the impact or the influence of spirituality in regards in connection to Black men's mental health. But I don't think a lot of, this is my assumption, and from what I've seen and what I've heard. I mean, personally, yeah, I'm involved in a church community, and a lot of my immediate close brothers are as well. But I don't know if that's the majority. I don't think that's the majority. I think a lot of men are searching for significance. And so that's why you have, at least in relation to Christianity, that's why you have a lot of Black men who are involved in like NOI, or at this point, like Hebrew Israelites or any other thing. But not so much Christianity. That's interesting to me.
So the general answer to your question is yes. The Black church plays a very important role. I have colleagues at the University of Michigan who've been doing research on this for years. The very first paper that I published back in the early 80s, when we asked people, what do you do when you're under serious stress? One of the top things they talked about was prayer. So that's one place where I think Black men are probably relying on assistance to get through tough times. But the problem is that we as men are probably not revealing our stress to our church members, to our family and friends at the level that we should.
That's very true, because we see so many people in the family come along and say, I didn't know he had this problem.
Yeah. I mean, when you say something like that, it reminds me of Don Cornelius.
Yes.
I mean, everybody watched Soul Train all the time. Don Cornelius's son, Don Cornelius committed suicide, unfortunately. His own son said those very words. I did not know my father was in such pain. Part of the reason he did not know, my speculation, is that Don Cornelius didn't really reveal the pain that he's in. So you're absolutely right. We tend to hold a lot of things in.
So the spiritual aspect of this is clear in terms of being a benefit if we would embrace it.
Absolutely.
But there's also treatment.
Yes.
Medical treatment, treatments of other sorts, different approaches that help people.
Sorry. I like that. It seems pretty consistent for Black people in general, that even if you're not involved in organized religion, if you're not going to a church or you're not practicing whatever, spirituality is still a huge part of our experience, of our collective experience. So whether that's you praying, whatever you're doing, I think that's important. And that I think that's something we need to pay attention to as we continue to do the work to become better. Like if these are aspects of us, we should pay attention to them and figure out how to utilize them to more effectively treat our situations, treat our issues, and continue to develop. Because yeah, if spirituality plays a big part, whether that's you were raised in the church or whatever, or you just have a deep interest in the spiritual, then we have to pay attention to that, and then use that probably in conjunction with what they're getting ready to talk about, which is probably more like medical treatment.
Of this is clear in terms of being a benefit if we would embrace it.
Absolutely.
But there's also treatment.
Yes.
Medical treatments of other sorts, different approaches that help people deal with and overcome their depression. Will you speak to that?
Well, this is where it can get kind of interesting. One of the things I guess I'd like to let folks know is when you get to the point where you're feeling like, whatever's going on with me, it's pretty extreme. I need to get a professional's opinion. I would encourage people that if they can afford it, to get more than one opinion. Because a lot of the times the treatment you get is going to depend on to whom you're asking. So if you end up going to your primary care physician for assistance, I think you're going to be more likely to receive medication for your symptoms. And medication for many of these symptoms helps. But let's say you went to a psychologist or a social worker, they're not really, they don't have the ability to write a prescription. They may advocate more of a talking therapy. Now, my opinion is that the combination of both is probably the way to go. So those options are out there for folks. I think a lot of us aren't aware that the kind of help you might get depends on who you ask. The other thing to keep in mind is going back to your point about the church. Very often your symptoms of depression can improve over time with what we call good old-fashioned social support. Now, I'm not advocating that people not see professional help, but I do want to put the word out there that emphasizes your point that community, people, one-on-one conversation can have an impact on the symptoms. What puts us at risk as Black men is when we work ourselves into, so we paint ourselves into a corner of social isolation. We are alone at the very time that we really need to be reaching out to others.
That's a very good point, especially in the senior citizen age groups and populations. They suffer most from desocialization than anybody in our society.
Yes.
So you take an elderly Black man who's in this situation with an issue, he's going to suffer even more.
Yeah.
I think that's an excellent point.
Yeah, I mean,
That's wild. My wife and I, we on a channel that we share, we just recently talked about like being millennials in generations, right? And like the different generations or whatever. And something that we touched on or we talked about is that how in this Western culture, in this society that, we all live in and we're a part of, very often the idea of communing or living together cross or multiple different generations is looked down upon and not encouraged. So when your parents get old enough, based off of how the system works, you put them in a home or you give them assisted living or whatever, you keep them separate. And then, you live with your kids for a period of time and then the kids get old enough and then you kick them out, so everybody is separate and you may commune with one another during holidays or particular traditions, but the cross generation is again frowned upon and not very encouraged. And that is isolating. Like we need our elders and we need the youth. And I think this society has these kind of beliefs and these ideas and concepts have crippled us from being able to be healthy, and be our best selves. And it's not good. Like that, even hearing that is sad. That's heartbreaking that a lot of, which reminds me, I have to make a phone call, which, a lot of, elderly, I would say elderly people in general are isolated, and they feel isolated. And on top of that, if you do have elderly Black men who don't reach out, because Black men in general don't reach out and communicate their feelings or share their thoughts or let people know what's going on with them, that becomes even more troublesome. That, like, that's not good. Like, I believe we were designed to live in community, to support one another, help one another, check in on one another. But that takes a level of vulnerability that very often one we're not encouraged to do. We're not encouraged to be vulnerable because it can be seen as weakness, and that's bad, and that's not manly. And we're encouraged to just handle everything by ourselves, which again is not beneficial. It's not beneficial at all.
One thing we should all be against is loneliness.
Absolutely.
Yeah.
Yeah. People help people.
Right. But I mean, I mean, the stuff is complicated on one hand, but on another hand, it's really simple. If I'm in pain and you and I are close, why wouldn't I reach out to you?
Absolutely.
I mean, sometimes it's inexplicable. But on the other hand, when you start thinking deeply about it, there's some ways that we were raised and socialized from the time we were boys that can sometimes put a barrier between two very good friends. I don't want to tell you that I'm going through something because I'm so wrapped up in my concern about what are you going to think of me and vice versa. We men need to get over that.
When a big portion of the treatment may be your ability to express it to someone else.
Yes.
That's very important. We're going to take a break. We'll be right back more with Dr. Neighbors and depression.
1 in 4 of us will be affected by mental illness at some point in our lives. Yet nearly 2/3 of us will never seek help, especially men. We pride ourselves on courage and our ability to never show weakness. But mental health touches us all. We are athletes, actors, and musicians. We are friends, husbands, and fathers. It's one of us, it's one of you. It's time for men to talk about mental health. Help starts with the conversation, end the stigma. To learn more about our stories, visit bringchangethemind.org.
Welcome
Haven't
back.
heard of that.
We're here with Dr.
I'll
Woody
look into
Neighbors,
that.
the CS Mott Endowed Professor of Public Health at the Michigan State College of Human Medicine. Woody, you head up a program called Man Up, Man Down.
Yeah.
Tell us about that program.
Yeah, Man Up, Man Down. I love talking about Man Up, Man Down. I'll give you a short version of that. Man Up, Man Down started as a research study funded by the Robert Wood Johnson Foundation. And I mentioned earlier how I was getting a case of description fatigue, and I wanted to move my research much closer to the community, to the neighborhood, to the men that I was concerned about. So we did a series of focus groups in 4 urban settings, including Detroit. And the focus group essentially getting around a table with about 6 or 7 men and just talking, trying to get the stories out. What's going on with us men? Let's tell the truth. And that's what Man Up, Man Down was. And we did all of our interviews at the University of Detroit Mercy. After every group, 2-3 men would say, when's the next meeting? And we would say, no, didn't we tell you that this was a research study? There's no next meeting. And they'd say, why not? We really enjoyed this. We actually feel better. And this little light bulb went off in my head is that, we need to have more meetings like this. So Man Up, Man Down transitioned from a research study to what we now call man-to-man health dialogues. But I think the thing you really want to know is, where did that phrase come from? Man up, man down. That's what I guess get asked all the time. Like,
Right.
what is that?
It's kind of opposite directions.
Yeah, opposite directions. In fact, if you look at our logo, the man down letters are upside down. And so this came out of some conversations that we were having. And I noticed that when I'm with, the guys that I hang out with, if we ever start talking about personal, issues, personal problems, and I say if, because most of the time we don't talk about that. We're talking about the tigers, the lions, cars, televisions, bigger televisions, but if the conversation turned personal, people would listen for a while, and inevitably somebody would say, I don't know, man, you just need to man up.
Hmm.
And I started thinking, what do we mean when we say that to another guy? You just need to man up. Well, I think what we're saying is, I don't really know how I can help you. I've heard enough about your personal situation. It's time for you to go somewhere and handle your business.
Hmm.
And so we started saying sometimes manning up can result in a man going down. So in other words, no man, especially no black man, should be expected to be able to handle every problem that life is going to throw at you.
Hmm.
That's just unreasonable. Manning up may work some of the time, but it's not going to work all the time. So manning up can result in a man going down. But again, here's the good news, that if you reach out for help, family, friends, or professionals, and you're the man down, you can be the man up again very quickly. So that's the story of Man Up, Man Down.
An interesting dichotomy.
Yeah.
When you talk about men's health, in the past you've referred to something called the 4 Ds. What are you talking about when you?
Right. So this is one of those quick elevator speeches, we all try to come up with. You only got a few minutes, and you're trying to get your point across. Yeah. So I came up with the 5 Ds.
The 5 Ds.
Yeah, five Ds. So it's depression, diabetes, dental health, disparities, and Detroit. So I would run around saying, I'm the guy with the 5 Ds, and then I'd whip them off and I'd say, if you're interested in any one of these Ds, then you and I need to get together and talk. So those are the 5 Ds.
How about that? And touching on a lot of aspects, a broad range of what affects African-American men.
Exactly.
And it's got to be in the top 7 of everything that we look at.
Yeah. I've always been interested in disparities. And I know in my own life, I've been struggling with type 2 diabetes for over 20 years. And I can go on and talk about that. I mentioned earlier, I've gone through my low mood periods.
Yeah, you and I share the same thing in terms of the loss of a child. Yes.
Oh, I didn't know that.
Yes, we do.
Yeah,
So,
it's the most devastating thing
absolutely.
anyone could ever go through.
Absolutely.
I get emotional just thinking about it. I'm very sorry that you had to go through that.
I for you also. However, there is a different side of that coin. It says that we can be down, man down can become a man up.
Yes,
in terms of depression associated with a loss of a loved one.
Yeah, and it's so true. And I can speak to it on a personal level as you can. There were many, many days when I never thought I would get back up, and was prepared to kind of live life down. The smartest thing I think I did was my 2 best friends. I called them and I said, once I get through all of the funeral arrangements, promise me that you'll go for a walk with me at least once a week. And I don't even know where I came up with that. And so, they came through. The 3 of us would go walking once a week and just talking about anything and everything. And that slowly but surely helped me kind of get back to where, I wanted to be.
I like that. I think that's a really cool idea. He would have that dedicated time to spend with his friends, to talk about stuff. And the thing that I've learned over time is that very often men prefer to talk and to be expressive and stuff while doing something. So whether that's playing sports, could be even playing video games or whatever, but activities seem to work better for us. Engaging in activities and then like talking while active instead of just sitting and talking. Which is, if that's the case for you, like try to leverage that. If you have a close friend that you need to catch up with or whoever is in your life, try to find activities to engage in together and talk so that it's easier for both of you to, or whoever's in your group to be, expressive and catch up with one another. Because we need community. We are not designed to be isolated. We need community with one another. And if we want to get better as men, we have to commit to that, and that's something that I have to continue to work on. We have to commit to being more engaged and being in regular community with brothers, because it's important.
Let's shift gears for just a minute. In the middle of the city of Flint's water crisis, I know that your relocation to Flint,
Yeah.
this is something that's near and dear to your heart also. What do you see the future of the citizens? What does the future hold for the citizens of Flint, Michigan, as it relates to this water crisis? Because we're not looking at a snapshot here in this issue. This is all a video, and it's going to go on for a while.
Yes.
But what are your hopes for the future?
Well, I think you really hit the nail on the head. This is not, in fact, I don't even use the word crisis most of the time, because now that I've been living in Flint for 8 months or so, and I've talked to a lot of folks, they have had serious concerns about water and infrastructure for a long time. It just so happens that this version of it hit the media. So that's one thing we need to think about. This is a chronic situation. And so you're absolutely right. It's going to be with us for a long time. My hope and vision would be that they replace the pipes, which, as you know, is going to cost a lot of money and take a lot of time. Most of the people in Flint still are not drinking tap water. There's still a lot of bottled water being drunk. So that's my ultimate dream for Flint, that they would fix this situation. But even more importantly, I really want to see jobs come back to Flint. Again, we think a lot about social determinants, and I know physicians, even though people think of physicians as only concerned with patient care, I think most physicians understand that the illness and disease that you treat comes from chronic stressful situations. So in a weird way, I think you would want to be put out of business by somebody going upstream and just eliminating the high degree of unemployment in Flint. The poverty rate is like 41%. That's ridiculous. So my vision of Flint would be that those things would be taken care of. But in the meantime, to be real about it, I've decided to focus my research and my intervention programs on behavior and lifestyle, the kinds of things that you and I and the rest of our brothers can do to take care of, feelings of grief or hypertension, diabetes. I mean, there's still a lot of things that we can do.
We've got a lot of unfinished business in those
We have
areas.
a lot of unfinished business and a lot that we need to understand about behaving ourselves. One of which is getting to the doctor regularly. But another aspect of it is, what are we going to do when we leave the doctor's office?
Woody, thank you for joining us. We will certainly do this again.
It was a real
Thank
honor.
you so much. Excellent.
Thank you.
We've been talking to Dr. Harold Woody Neighbors, the C.S. Mott Endowed Professor of Public Health at the Michigan State College of Human Medicine. For Primary Care, I'm Dr. Lonnie Joe. You can get more information about the show.
I'll just leave it there. I thought that was pretty good. Actually, I need to I thought that was pretty good. I think the last thing that the doctor shared is true, like developing better behavior. And Dr. Neighbors is his name. But developing better behavior in our men and in our community is really, really important. Because there are tons of systemic issues and problems that need to be addressed and that we need to try to fix. And I think it's hard. I'll say it's hard when you have so many problems and so many issues that need to be addressed. I think what's important, at least this is my perspective, what we need to do is try to address some of the deeper core issues that ultimately funnel into the other stuff. Because again, we can be trying to address and fix lots of symptoms and other systemic issues, but never really going to the source of the problems. And so we're just going to keep having the same systemic stuff over and over and over again. And for me, similar to Dr. Neighbors, I think it does start with our mind. It starts with what we think, what we believe, which ultimately impacts how we behave. And that's something I think we need to address. We need to fight for. We need to fight for a better mental and emotional health state for our men. Because I believe that if we're in a better mental condition, better emotional condition, and we have better thoughts and better beliefs and better perspectives on how to live, that will impact the work that is done so that we can address all of the other issues. But if, again, the head is sick, it's really hard to do any of the other stuff. But yeah, thank you all for joining me for this study hall. We're going to wrap it there. If you want to go watch this video yourself or reference it yourself, I'll put the link in the description. It's called Depression in Black Men, and it was created by OurHealth Media Network. Yeah, yeah. Again, point of the study hall is to continue to do research, continue to learn, and continue to do work to get better, and to continue to strive to be beneficial. So, Black man, I believe in you. Continue to do the work to become a beneficial man. Protect your mental. Find time for an emotional release valve. And keep striving to become beneficial. Go make something for yourself, make something of yourself, and make something for glory and for good. Stay safe out there. Peace.